A very good afternoon, everyone. Uniting for closing the care gap, supported by AstraZeneca. I, Dr. Ruchka Gambhir, your host for the day, would like to welcome our esteemed guest speaker, Dr. Srivatsa N for today's session, shedding light on urinary bladder cancers, insights, and awareness. Dr. Srivatsa is currently working as a consultant urologist and robotic surgeon at Sri Shankara Cancer Hospital.
A very good afternoon, madam. Thank you very much for your kind introduction, and I'm really excited to be a part of this discussion.
Sure. So before we start this whole discussion, I guess, we should start with the most basic question, which is basically what exactly is a urinary bladder cancer, and what are the risk factors associated with it?
Yeah, I think it's a very important and a fundamental question that all of us should know about. We have two bladders. One is a gallbladder, the other one is a urinary bladder. Gallbladder processes bile and is situated next to the liver, whereas urinary bladder is deep inside the pelvis. The key function of urinary bladder is to store and excrete the urine produced by the kidneys. This is a very important function because not only does the urinary bladder accommodate reasonably large volumes of urine without causing any and more importantly, urinary bladder cancer also prevents. Now, you asked me about the risk factors associated with urinary bladder cancer.
Yes, sir.
I would like to start by giving you a broad overview of what the disease burden currently prevalent is, and then go on to discuss the risk factors. There are more than 600,000 cases of urinary bladder cancers which are diagnosed across the world. And
Okay.
this is as per the Globocan data in 2022. And India alone contributed to close to about 28,000 of these cases. That's a significant number. And the Globocan also estimates that there is going to be a whopping rise of about 79% in the incidence of these cancers by the year 2030. These urinary bladder cancers, which can happen via which it affects. It's estimated that the mortality rate of bladder cancer is around 3.4%. And if you want to know the mortality rate of bladder cancer, meaning to say,
Okay.
if there is a person affected with cancer, the probability that there could be a death related to this cancer is only 0.9% year on year. It may not happen this year, but it may happen next year with a higher mortality. And in comparison, the bladder cancer mortality rate is 3.4%, almost four times more than that of the average other cancer that is encountered in the human body. So, it kind of becomes, very important for us to know about bladder cancer more and more, because there are certain risk factors which can trigger bladder cancer, which can be very easily prevented or avoided, and thereby reducing the burden or risk of bladder cancers. I would also tell you that the bladder cancer in itself is a very unforgiving disease, and it causes steady progression in all instances. It's not like some other cancers, like the cancers of prostate or thyroid, where the cancer is very, very slow growing or can be even dormant for many years. And therefore, it becomes very important for us to understand what the risk factors of these urinary bladder cancers are and see where all we can, try and modify these risk factors. Like any other cancer, we have modifiable risk factors for bladder cancer and non-modifiable risk factor for bladder cancer. The modifiable risk
Okay.
factors are tobacco consumption in any form. It could be cigarette, BD, gutka, pan parag, zarda. I know, I mean, all of us know that tobacco can be used in many forms. Snuff, for instance. Tobacco consumed in any form is very, very dangerous for any cancer, and even more dangerous for bladder cancer in particular, because it contains certain chemical substances which have the amine derivative in them, which are exclusively excreted in the urine. All these chemicals which are excreted in the urine are accumulated for variable periods of time in the bladder, and therefore even if the kidney excretes the toxin, it is the bladder which suffers, because it's the bladder which holds this toxin for a reasonably longer period of time. Whatever urine is produced in the kidney is sent down to the bladder in less than a minute. So the vulnerability of kidney is much, much lesser in comparison to what the bladder is vulnerable for. The second risk factor is alcohol consumption. Recently, the WHO has given a guideline saying even 1 gram of alcohol consumption can be, hazardous in terms of increase in the risk of cancer. And more interestingly, I want to use this opportunity to highlight one of the risk factors that we are not, commonly aware about. That's the hair dye usage. A lot of people today use hair dyes, especially hair dyes with certain ammonia compounds in them. We also get hair dyes without ammonia, but majority of the hair dyes contain certain ammonium compounds. These ammonium compounds are absorbed through the scalp, gets into the blood circulation, can't be excreted any which way other than in urine. And like I mentioned before, it gets out of the kidney, comes to the bladder, and gets accumulated there and gets stored there for a while. When it is in the bladder, it causes contact irritation. And over a longer period of hair dye usage, we have seen a lot of patients develop bladder cancer. So, I would really want to use this opportunity to, encourage our viewers today to try and avoid using hair dyes, or if not possible, at least minimize the use of hair dyes to only when it is required. Certain consumption of artificial sweeteners, saccharin, for instance, or artificial sweeteners which most of the diabetics use to sweeten their food consumption over a longer period of time can also give rise to increased probability of bladder cancers. High red meat intake can also give rise to bladder cancers. Consumption of excessive oral contraceptives in women can also give rise to bladder cancers. And more importantly, certain toxins, industrial toxins like the arsenic or the nitrates, can also give rise to bladder cancers. Another common risk factor that we are often seeing nowadays, which can trigger bladder cancer, is excessive chemical, pesticide, and herbicide usage in the agricultural practice. Today, most of the agriculturists are using all these chemicals and pesticides and herbicides. Herbicide is where they spray these chemicals and the weeds are killed. Usually the weeds have to be manually cleared, isn't it? That is hard work. To
Yeah.
minimize the hard work, lot of people are now using certain herbicides like glyphosate, what is typically called as Roundup, which is banned in most of the countries but unfortunately still available in India, to clear these weeds. These chemicals, the glyphosate especially, remains as a residue in the soil, gets mixed with the water administered for growth of the plants, get absorbed into the plant and gets deposited in the food. And these chemicals are known to produce bladder cancers. Then is the industrial exposure, arsenic especially. which can give rise to bladder cancer development, and certain chemicals used in the rubber industry, leather industries, paint industries, tires and automobile industries can also give rise to development of bladder cancers. So these are the modifiable risk factors, wherein if we are aware that we are getting exposed to any one of these substances, we can try to minimize the risk by limiting the exposure wherever possible, or for example, in cases of tobacco or alcohol consumption, completely abstaining from it. Unfortunately, there are also certain non-modifiable risk factors. Yeah. Then we have the non-modifiable risk factors like age, gender. Men are more prone to develop bladder cancers, chronic infections, especially urinary tract infections, and there are certain specific infections like infections with schistosoma hematobium, which is very commonly seen in the Middle East, which can give rise to bladder cancer. The hereditary risk factor for development of bladder cancer is extremely low. However, there are certain hereditary syndromes like the Lynch syndrome, which can give rise to development of bladder cancer.
So that's quite an insightful answer. Actually, never thought that hair dyes could also be a result of like kind of can result in the bladder cancers. But that's quite an actually insightful answer. Thank you for that. Moving on, we like to understand what are the early signs that are that have been noticed by the individuals, and basically with what are the early signs which people come up to you so that it
Yeah,
can kind of help you in diagnosing it.
yeah. Again, a very important question because this is what people need to know. So, the most common symptom of bladder cancer is hematuria. So, in a layman term or a common terminology, hematuria actually means blood in urine. So, whenever a person visualizes blood in urine, it is most oftenly because of bladder cancer until proven otherwise. Blood in urine, the urine may appear pink, it may appear red, or it might even appear cola colored at times. It may have clots in them, it may be without clots, but no matter what, even if one episode of blood in urine happens or hematuria happens, it needs to be evaluated thoroughly to make sure that we are not dealing with bladder cancer. The second most common symptom is frequent urination. The patients might feel that they need to urinate more often than usual, and whenever they urinate, they may encounter or experience pain either throughout the process of urination or in parts, either in the beginning or in the end. So, this is another common symptom that we see. Very rarely, as the disease advances, patients can present with low back pain, especially without any other antecedent cause like stretch, strain, or trauma or anything of those sort. Pelvic pain, especially in women, and bone pains or unconditional weight loss. When patients are not making any effort to lose weight, people are not making any effort to lose weight, they continue to lose weight, or sometimes even feel that they have lost their appetite. But unfortunately, these are signs of advanced bladder cancer. The key signs and symptoms of early bladder cancer is blood in urine, increased frequency of urination, and pain while passing urine.
Got it. So that is quite an insightful answer again, and I guess that is something which people should actually remember. And I hope people don't suffer from it. But in case anyone is suffering from it, it is kind of now it's the time for them to reach out to the doctors. So moving on, we would like to understand that how does this bladder cancer affect the everyday life of an individual? Basically, we would like to understand from your point of view what a typical journey of a patient with bladder cancer looks like.
Like I told you, Dr. Ruchika, in the beginning, bladder cancer unfortunately is a very unforgiving cancer. So, if it's not attended to, it continues to progress and continues to create one or the other complications and symptoms and cripples or debilitates the patient considerably. So, a vast majority, I would say 70% of patients with bladder cancer at presentation are in early stages. That's the best part. So, if identified early, they can be treated with very minimum manipulation, and they can get back to complete normalcy. If for some reason the patients are not identified and they progress, then one or the other complication starts developing. The blood in urine, which could in the beginning be once in a while, can start becoming consistently regular, meaning to say with every urination, patient will start experiencing blood in urine, and this over a period of time can deplete the hemoglobin, causing severe anemia in the patient with all other attendant complications of anemia. As the bladder tumor grows, the pain in the pelvis can start worsening. The bladder tumor can get out of the bladder, start invading the other structures, and can cause complications like rectal bleeding, constipation, obstruction to passage of stools, and more importantly, this bladder cancer can obstruct the urine flow which enters from the kidneys into the bladder through the two tubes called ureters. When this happens, the patients can actually end up having a renal failure or kidney failure. So these are the signs and symptoms of advanced bladder cancer, and patients who develop these symptoms, these complications, will also develop the symptoms related to these complications. Like patients with kidney failure will start having breathlessness, swelling of the body, difficulty to walk, lack of appetite, so on and so forth.
That's quite, I guess, intense and something unfortunate to listen about at how it affects the life of an individual. Now, when we have already talked a little bit about what urinary bladder cancer is, what are the signs and symptoms, the risk factors, the complications, we would like to deep dive into bladder cancers a bit more and understand about the non-muscle invasive and the muscle invasive bladder cancers. We would start by understanding the difference between the two.
Okay. So, like I told you before, 70 to 80% of bladder cancers, at presentation or at diagnosis are non-muscle invasive, which actually carries a better prognosis than the muscle invasive bladder cancers. To understand what this is, we need to understand the basic anatomy of the bladder. So,
Okay.
for all practical purposes, bladder has four important layers
Mhm.
in its anatomical structure.
Okay.
The innermost layer is called as the mucosa.
Mhm.
Then the second layer is called as the submucosa. The third layer is called as the muscularis layer. And the fourth layer is called as the serosal layer. So when the tumor is present either in the mucosal layer or the submucosal layer, it is called as a
Mhm.
non-muscle invasive bladder cancer. As soon
Okay.
as it involves the third layer, which is the muscular layer of the bladder, it becomes a muscle invasive bladder cancer.
Okay.
So, a non muscle invasive bladder cancer is predominantly confined or limited to the bladder. The moment it reaches the muscle or the third layer, the bladder cancer will have a strong propensity to spread out of the bladder into different parts of the body. The reason is between the submucosal layer and the muscular layer is a plexus of blood vessels and lymphatics, and these blood vessels and lymphatics are interconnected throughout the bladder and also drain outside of the bladder. So the moment the tumor invades this layer and goes beyond the muscularis mucosa, the cancer cells will have a free access to get out of the bladder. So that's the reason why, for management purposes, we have classified bladder cancer into non-muscle invasive and muscle invasive.
So now continuing to the previous question only, we would like to know that how many cases you do know does come to you for muscle invasive as well as for the non-muscle invasive urinary bladder cancers.
Yeah, so we are a tertiary care cancer center. We are a high volume center, and we end up seeing about um, close to about 200 non-muscle invasive bladder cancers every year, and we see about 55 to 60 muscle invasive bladder cancers every year. The percentage what I mentioned to you, 70% non-muscle invasive and 30 muscle invasive, may not work in a center like ours, which is a referral center. This is the worldwide population. We end up seeing almost higher proportion of muscle invasive bladder cancers because these cancers are more difficult to manage, cannot be managed uniformly in the peripheral centers, and hence get referred to us for further management.
Okay. And how many patients progress from the non-muscle invasive cancers to the muscle invasive cancers despite the treatment being provided? And also, how long does it take for a patient to progress from non-muscle invasive to muscle invasive?
Yeah, very complex questions, I must say, but the answers are very important. So, like I said before, bladder cancer is an unforgiving disease. I want to keep repeating it because it's very important to understand this. So, if we do not treat bladder cancers on a timely basis, all non-muscle invasive cancers will progress to become muscle invasive. A
Okay.
vast majority of non-muscle invasive cancers can become muscle invasive in as less as 1 year time.
Okay.
Yeah. The other critical aspect of non-muscle invasive bladder cancer is its propensity to recur. Meaning to say, if we have treated these non-muscle invasive bladder cancers and do not do anything beyond the basic treatment, these tumors will have a tendency to recur. Just to give you an idea, close to 78% of high grade non muscle invasive cancers, bladder cancers, will recur in less than 1 year if we have not done additional treatments.
Okay.
And they can progress to become muscle invasive. So, it is important for us to identify non muscle invasive bladder cancers and treat them not just with the first line of treatment, but also with maintenance therapy. And therefore, do our best to make sure that these cancers do not recur. I would also want to, briefly highlight to you of how we treat these cancers. So,
Please go ahead, sir. That was actually my next question, which I was going to
yeah,
ask you that how do we, what is the treatment pathway? So I guess that
correct.
that would be actually be helpful for us.
Yeah.
So
So,
please go ahead, sir.
yeah. So the non-muscle invasive bladder cancers are pretty straightforward to treat. We do not even, most of these non-muscle invasive cancers need to be operated for curative therapy. But the best part is these surgeries can be done on a minimally invasive basis. We do not even make one single cut on the patient's body. We use the natural urinary passage, the urethra. We introduce certain endoscopic instruments, visualize the bladder tumor, and resect them from within. Meaning to say, there is no cut involved anywhere in the body.
Okay.
Just a naturally utilized orifice, the urethra, is enough to complete the surgery. Once the
Okay.
surgery is complete, we risk stratify based on the histopathology or the biopsy report and see what is the grade of this non-muscle invasive cancer. If it is low grade, whatever we have done in terms of surgery is more than enough. If it is high grade, then, like I mentioned, the propensity to come back is high, and therefore we introduce certain medications into the bladder periodically, what we call as intravesical therapy, to minimize the risk of recurrence. So there are many
Okay.
substances or many drugs which we use to reduce the risk of bladder cancer recurrence. The most common one and the most effective one is the intravesical BCG therapy. Again, not many people will know. Almost everybody who have had a child will know about BCG because that is the first injection to be given to the child. And this BCG injection is given to the child to prevent the child from developing tuberculosis, TB, as is popularly known. The same BCG given in a very high dose into the bladder can prevent or reduce the risk of development of reoccurrence of bladder cancer. So we use the same BCG but in a very high dose, instill it into the bladder periodically, say like for instance once a week for about 6 weeks, and this can reduce the risk of bladder cancer. Not only that, once the initial treatment is done, depending on the kind of disease that the patient had, the treating doctor might even decide to continue this intravesical BCG therapy on a monthly basis for about 1 to 2 years. And by doing this, the overall risk of recurrence considerably comes down into single digits. We also have certain other chemotherapeutic drugs like mitomycin, gemcitabine, docetaxel, or a combination of these drugs, which can be used to reduce the risk of recurrence as well as progression of this non-muscle invasive bladder cancer into muscle invasive bladder cancer. All problems start when the cancer was identified as muscle invasive. Then suddenly, because like I mentioned before, there is a higher chance that because of the lymphatic plexus involvement, the cancer can actually spread to other organs as well. So muscle invasive bladder cancers eventually end up getting their bladders removed. So muscle invasive bladder cancers eventually end up getting their bladders removed. So this is actually a very major surgery. It's a morbid surgery and can have certain functional and quality of life, challenges. Sometimes we also decide that we need to give chemotherapy into the veins, like how it is routinely done to reduce the burden of cancer and then go ahead with removal of the bladder. Very rarely, if the muscle invasive bladder cancer is low volume, meaning to say very small, like say less than 2 centimeter or 3 centimeter muscle invasive bladder cancer, present only in one area of the bladder in a very favorable location, we can even at this stage try to conserve the bladder by doing a limited surgery and then giving chemotherapy and radiotherapy, what we call as bladder conservation surgery or bladder conservation treatment. But the number of patients who qualify to get this bladder conservation therapy are very small. And unfortunately, most of these patients end up getting their bladders removed.
So I guess that's quite an insightful answer, and thank you so much for explaining about the treatment part with in such a nice way. Uh, Moving on, I would really like to know, since you have already explained that there are the chemotherapies and the drugs which you guys administer for kind of treating the patient. Every drug comes with side effects. So, what are the side effects which are associated with this treatment, and how to cope up with them?
Yeah. So this is a very long answer, but I'll try to keep it very short because there are a lot of side effects that can happen in a patient with bladder cancer. For instance, in a patient who has had a surgery where the bladder has been removed, how does he pass urine? So we need to create a urinary
Yes.
diversion. So the urinary diversion can be created in two ways. One is an internal diversion where nothing is visible outside. We create a neo bladder and connect it back to the natural passage, but it is not like a God-given bladder. So there is no sensation. The patient has to go and pass urine with some exertion on a timed basis, and because urine contains a lot
Okay.
of toxic metabolites and intestine is designed to absorb, a part of these toxic metabolites can get back into the bloodstream, causing a variety of complications. So to minimize that,
Okay.
we can also divert the urine but get it onto the abdominal wall and put a pouch. It's called as an ileal conduit, and this pouch is visible externally. Of course, if you wear clothing, it can be hid under the clothing, but it is a body change. So there is some amount of drop in quality of life of these patients, and patients do encounter certain complications like infections, metabolic complications like metabolic acidosis, higher risk of stone formation, so on and so forth. When a patient receives chemotherapy, you all know chemotherapy can be quite toxic. It is very potent in killing the cancer cells, but it can also affect the normal cells. So patients feel weak for variable periods of time. They can develop neuropathy or numbness or abnormal sensation in the hands and feet. They have hair fall, but of course, most of these side effects are reversible. Radiotherapy also, can create some amount of local pain, local discomfort, lack of appetite, bowel related complications, so on and so forth. When a patient receives radiotherapy, there are many more such side effects. Psychooncologists, nutritionists, dietitians, everybody should come together, to make sure that patients, morale is up. They gear up to the requirement and then cope with the side effects.
So that sounds like quite a big complex insightful session. Thank you so much for sharing your insights with us on that. And I hope that with today's session, many people are able to take care of the lifestyle changes they need to make, the risk factors associated, and understand how serious this issue can get or get converted into. So I hope a lot
Exactly.
of people now kind of practice a good healthy lifestyle. That is what we would really hope. so that we could everyone together can fight cancer. So, with that, we'd like to end our session. Thank you so much, Dr. Srivastava, to join us today and for sharing all these useful insights with us today. It was really a great pleasure to connect with you, and we hope that your insights will really help the younger generations or the generations to help fight the cancer and avoid, and if in the first place, and very importantly, to avoid getting infected with these kind of problems. So, thank you so much, Dr. Srivastava, for joining us today. We really appreciate your effort. Thank you so much.
Thank you very much. Thank you very much.